Hello, everyone. Welcome to our third session of the Health Literacy in Action Conference. I'm Cynthia Baur from the Horowitz Center for Health Literacy in the University of Maryland School of Public Health. And I'm very excited to be here with a longtime colleague and friend, Greg O'Neill, who is the Director of Patient and Family Health Education at ChristianaCare in Delaware. He and I are going to talk to you today about the health literacy initiatives in our respective state. We'll have a little dialogue about that, and we'll be monitoring the chat and comments for your comments and questions. So I'm going to go ahead and get started, and then I'll turn it over to you, Greg.
Cool.
Okay, so I titled my presentation about Maryland, the ABCs of Building Maryland's Health Literacy Initiative. And the reason I went with that title is this presentation caused me to reflect back just on this trajectory that the center has been on since 2007. And it really has been a journey of thinking about fundamentals, about what it takes to build something that will last for the long haul, and how it is that we sustain this as a statewide initiative. Because of my background working on the Healthy People Initiative in the federal government for so many years, everything that I work on is always grounded in the Healthy People framework. And I think as a field, we were very fortunate in Healthy People 2030 that health literacy was explicitly addressed as part of a focus on addressing health disparities and health equity. That these three concepts were very tightly linked in the Healthy People 2030 framework. And the documents around Healthy People 2030 made the statement that we cannot eliminate health disparities or achieve health equity if we are not focused on health literacy. And I think that in our current programmatic and policy environment, which is what this conference focuses on, is health literacy programs and policies, I think it's just a good practice to make sure that all of our health literacy work is really thought about from a health equity frame. So the Horowitz Center, which I am the director of, was founded in 2007 as part of a public school of public health for research, teaching, and service to the Maryland communities at large. And I think that's a really important distinction to make, and not to say that other types of schools of public health don't have a strong mission. But as a land-grant university, and then for those of you who were in the prior session, you heard from one of my University of Maryland Extension colleagues, as a land-grant institution, we have a strong mission to serve the public and to really think about the needs of Marylanders. And that spirit, that philosophy has really infused the Horowitz Center from the beginning. And even though we exist as an academic center within a university structure, we have had a strong focus on our external partnerships throughout the whole time the center has existed. And we've really focused on building our reputation and relationship through these external partnerships. I am the third director of the center, and each director has brought their own priorities and focus to what they do. So we've worked on health literacy in many different areas. For example, the first director was here when the Affordable Care Act was passed and had a strong focus on health insurance literacy. The second director was very interested in health literacy in the K through 12 education space. And we have really done a lot of work with local health departments and local health improvement coalitions here in Maryland. So you can see that we have a really diverse portfolio in terms of how we engage with Maryland communities and organizations. The big change for us as a center came about in the 2022 legislative session here in Maryland. As a result of a bill that became law, known as Maryland HB 1082, the Consumer Health Information Hub law, it put in place Maryland's infrastructure for both plain language and language access. So the law requires that public information about four types or buckets of information: health, safety, health insurance, and social services benefits have to be in plain language, and the agencies that provide this information have to provide language access. So the requirements pertain to state and local public agencies, and then are recommended, so not required, but recommended for other types of organizations such as healthcare, community-based organizations, other information providers. The law also designated the Horowitz Center as the lead agency to implement and evaluate this hub approach. And the legislature provided funding in fiscal years 24, 25, and 26 to implement this work. So recently, in 2024, this law was reinforced and expanded to all state agencies by an executive order from the Maryland governor. And it gave responsibilities to Maryland's digital services team to lead plain language for state agencies as part of a digital accessibility initiative. But Maryland had been building this legal infrastructure for many years. You can see that back as far back as 2012, there had been a law that recommended, not again required, but recommended that health profession students, and that would be in nursing, medicine, public health, be educated in cultural and linguistic competency and health literacy. And that was followed by a recommendation for training of licensed health professionals, getting training in cultural and linguistic competency, health disparities, and health literacy as part of a relicensing process. So this put responsibility on the licensing boards within the state of Maryland to make this training available to licensed health professionals. Then in 2019, not necessarily from a health literacy perspective, but more from a patient rights perspective, the Maryland legislature passed the Patient Bill of Rights. And within that Patient Bill of Rights, one of the rights is the right to clear, understandable information that patients can actually make use of. In 2022, the access to language access and access to public services was reinforced by an equal access to public services for people with limited English proficiency change to the law. And then in 2023, specifically focused on improving oral health in the state of Maryland as part of a broader law expanding access to oral health services. There was a requirement that the state provide plain language information about oral health. So again, you can see sort of we've been piece by piece building this legal infrastructure within the state to get at this public access to understandable, useful information. So the way that we have been presenting plain language here in Maryland is in accordance with the federal plain language guidelines. We've established a Maryland plain language checklist as part of the brief, as part of implementing the hub. And we focus on some key techniques on everyday words, on short sentences, active voice, the use of pronouns, presenting information using headings, list, and chunking of text, as well as providing visuals. So you can see that it's not every single aspect that you would find in the federal plain language guidelines, but it is some of the most frequently used plain language techniques that are commonly taught in plain language training. And we felt that it was really important to give people a manageable list of techniques to focus on. The other thing we do is we really emphasize this audience focus, right? We, when we are consulting with organizations and groups about their information, we always start out by asking them, what is it you want people to know and why do you want them to know it, right? We ask them to really think through this whole notion of audience before we even get into talking to them about the plain language techniques. And then because HB 1082, the hub law, talks about expanding access to information, we also raise these questions about how the information will be distributed. So if people tell us they want to create a lot of brochures or flyers or posters, right from the beginning, we ask them questions about where and how this information will be distributed, and do they actually have a feasible plan for getting that information out to the audiences that they're trying to connect with. So we've really framed this as an information equity issue. And I'm sorry, my slides did not translate here when they got uploaded. But the idea is that we're touching on personal health literacy, we're touching on organizational issues, and we're also touching on health policy, because the reason the law exists is to ultimately make information accessible to all Marylanders in their preferred language. So we are trying to do several things under the hub. We are trying to increase the supply of plain language information, and that's all the work that we do with organizations, right? That's an actual requirement in the law. What's not a requirement, but was a lot trickier, is to increase Marylanders' demand for plain language information, for them to begin to expect plain language when they interact with health departments, with community-based organizations, with social service providers, with their health departments, right? So that's the demand side of the equation, is that by talking about plain language, by doing presentations, by raising people's awareness, we hope to really change the demand side of the equation. And then ultimately, we are trying to really make sure that information, plain language information, is circulating a lot more widely to all Marylanders. The ultimate goal is hopefully to build the health literacy of all Marylanders so that they do have the skills and the confidence to get the information they need when they need it and to make those informed decisions. So these are some of the products that have resulted from our work on the hub. We do material reviews when organizations request them. We have made several rounds of offers to do these material reviews, and organizations have taken advantage of that, and we write reports and give them written feedback about their materials. We do a lot of training. We provide individual consultations. We do monthly webinars, which are recorded and posted on our website, so people can go back and listen to those anytime. They can use them as training resources in their own organization. And then we do workshops. So for example, we've had a couple of counties that asked us to come and do workshops for groups of 20 to 30 people out of their local coalitions, so that they can, as a group, learn these skills and start focusing on some of their materials that they are distributing in the county. I mentioned that we had created a Maryland Plain Language checklist based on the federal plain language guidelines, as well as a checklist that was used by one of our state agencies already. This checklist has been out there among our partner organizations for over a year now. We use the checklist ourselves, so it's been pretty well field tested at this point, and we feel pretty confident that the things on the checklist are making a difference in terms of helping us give feedback to state and local agencies on their materials. We also created what we call our web review tool. So this is a very small number of items that really affect how information appears on websites, given that so many of our agencies that we deal with use their websites as their primary communication tool with the public. We recently finished a set of health literacy criteria for media campaigns for the public, and also for grant and contract procurement activities. So these were specific requirements in the hub law to write these health literacy criteria, and for organizations that are doing media campaigns in the state to submit their campaigns to us here at the center to review using the health literacy criteria. The same process is also mentioned in the law for or agencies when they are issuing new notice of funding opportunity announcements or otherwise grants, or doing vendor procurements, right? So let's say a government agency is hiring a communications vendor to produce a series of fact sheets and posters for them. under HB 1082, that agencies should be using these health literacy criteria when they issue the contract with this vendor. We've also created an evaluation plan and a logic model, both of which are public and on our website. We also published our first year evaluation report. So you can go on the Hub web pages and you can find our report from the first funded year of the Hub activities. And then finally, we have lots of other resources that we posted on the Hub web pages. We run a couple of work groups, and we also have done public convenings. We did two convenings last fall, and we have two more public convenings in person that will happen in March 2025. So with that, I'm going to turn it over to Greg to talk about the things going on in Delaware, and then he and I will chat for a little bit about the things going on between our two states.
All right. Thank you, Cynthia. I really do want to thank you and give a shout out to you as a longtime mentor of mine. I've looked up to the work that you're doing, so thank you. And we're neighbors. So I remember back to my first Health Literacy in Action conference, I believe it was in 2018. So definitely an honor for me to be presenting with you today, so thank you. I actually had, if you recall, when we started our council work in Delaware, we had you as the very first guest speaker in Delaware. So it's coming full circle here. All right, let's jump in. Delaware. I will be showing a map later, in case you're wondering, where is Delaware? Assuming you know where Maryland is, we're right next door. I'm going to dive right into what we've been doing here for the past few years. All right, so our goal with this work, like many of us in this field, is to strive for equity through literacy. Now, what that means for us is I'm not going to share a whole lot about the why we're doing this, because if we're all here today, we know why. But just to shed a little light on it, here's what Delaware looks like. And we have challenges from a general literacy standpoint, in addition to having challenges in the health literacy focus area as well. So plenty of work to be done in our little state, and that's what we're striving to do. So we have been really kind of up and running for roughly 5 years, but I will say most of the work that you're going to see here today has really transpired in the last couple of years as we've gotten a little bit more funding to keep things moving. One of our goals through this whole endeavor has been to not reinvent the wheel. So we want to beg, borrow, and steal, and mostly reference anyone who's already doing great things nationally and used tools that are already out there. A bunch of the tools that you've already seen from Cynthia and Maryland, I think, are really leading the way in how to do that. So we don't want to spend a lot of time reinventing the wheel. We think this will also help make this state model more easily replicated, because if we're all doing this kind of as a side job or as an extra initiative in our state, we may not have the resources initially to go out and create a whole bunch of new assets or processes. So if we can use the best in breed that's already out there, let's do it. The reason I put that caveat out there is the Health Literacy Council of Delaware has no staff. So this is truly a coalition model in our state. We are not part of any broader entity or structure. So it has really been a grassroots effort. And I think in the past couple of years, especially, we've really accomplished a lot through that model. So one difference you might see with our model is a really sort of a hospital-based starting point, being that I am the Director of Patient and Family Health Education at ChristianaCare. I thought that the health system had an obligation to make sure that we're communicating in the best possible way with our patients and families and community. And as a leader in our state, we had an opportunity to push that work outside of our four walls and see what kind of things we could do as a state to more collectively move in a shared mission direction. So you'll see here that our strategy really, while it is kind of centered around the health systems, we have built some coalitions with other really strong leaders in the state. One of the biggest ones being the Division of Public Health has been a huge supporter throughout this. We have folks from the education sector. We've got some payers involved and a whole bunch of community-based organizations. So we wanted to utilize networks that already existed out in state work happening on other things, and just bring the health literacy lens and conversation to those groups, and then see if we could get buy-in. And that's basically what happened. So we've had some great partnerships from the get-go, and right now we've got a really strong representation from all these different sectors, really trying to just simplify our approach as a state so we can all be doing the same kinds of activities. We think the benefits of this council are going to be that aligned mission, improving safety, reducing inefficiencies for sure, enhancing quality of life. And of course, the experience of care is greatly impacted by how people experience their communication around healthcare. So what have we done? Let's dive into that. All right, so 2023 was a big year for us. We had a national forum on best practices. So we had a whole bunch of people come and tell us what they're already doing, so that, again, we could not reinvent the wheel, but just pick up where a lot of the work has already brought us. We did a landscape analysis for our state. I will say, when the funding started to come in, we did hire out some consultant servicing to help drive the sort of operations and logistics of the council, because I couldn't do it all on my own, and it was, like I said, a coalition style foundation. So it was really no one's primary job to drive this work. So after we had that landscape analysis, we had a pretty large strategic planning session within the state, 100+ statewide stakeholders, which is really great. And that full report is available on our brand new website, which is cool. And then we really started getting to work around how are we going to meet those strategic goals. And so we formed 3 subcommittees that will focus on the deliverables over the next couple of years to drive that work. And we were successful last year in getting a proclamation from the governor. So that was fantastic. Just kind of put cherry on top of that work. This is just a glance at what the report looks like. You can find this on the website. It's kind of small here, but really just wanted to focus on the fact that we thought we could move the needle in terms of policy and advocacy, community outreach and engagement, and education and training. So we've got subgroups of the council working on all of those things. All right, so to keep us moving forward, 2024 has also been a big year. If you go out to healthliteracyde.org, you will find our website that is new as of July. And this was a very mindful, thoughtful creation of bringing everyone together around this mission and giving us a place to work and to promote what was happening in the state. So we are going to be using this website to have best practices around and resources around how to train up for health literacy. We're also going to have some things on there around how to spread the word and advocate, get involved in terms of policy advocacy, things like that. We also have a pretty big program that we're proud of that we've been working on the last year or so, to try and get as many people as possible trained up through the IHA certificate program. So through some different revenue sources that we put together and support, we were able to get over 100 people kind of lined up with vouchers to take the IHA certificate course. So I think that's a really big one from a training perspective and from a stakeholder buy-in perspective, because if we can have a small army of people with that in-depth view of health literacy and kind of a new um, burning desire to do something about it, uh, we can have, we can sort of democratize health literacy expertise in all of the organizations that are partnering with us and create local champions. So I think that I'm really hoping that that's going to be a thing that really kind of gets the momentum going over the next couple of years. And then we also did, we don't, like I said, we don't have a staff per se, but we did try piloting as a council what it would be like with one of our funders to help them design new assets. So through that was kind of a really fun, interesting process, and I'll share a little bit more about that later. But it went pretty well. That, of course, would take a lot of more resources to scale up. So what are we doing here? These will be too small to see, but I just wanted to show you the stuff that's on the website. So we've got one thing we wanted to do is make it easier to advocate and to train up. One of the things that you can do is do all the things that are available every October, right? So we have a year-round events calendar that is now live on our website, where anyone that wants to can submit an event related to health literacy. It can be local, it can be national, anything, webinar, whatever it is, tabling event at a conference if you want people to know you're there and to go. And that events calendar is there for everyone to see and use to promote activities. We also have built the resources part of our website to really sort of ramp up. So if you're just finding out about health literacy and you want those quick bite kind of things to learn a little bit, have a little bit more awareness, say a 5-minute video, okay, we've got those. But if you want to dive in a little bit further, we've got mid-level and then we're all the way up to the IHA certificate program. So regardless of the audience readiness, there's something there from top to bottom for how engaged they want to be in skilling up in best practice. And then we have sort of our take action area in our website where people we can do a consultation meeting. They can connect with us to stay in touch with all of our newsletters and socials and all kinds of outbound communication. They can join a subcommittee. One of the things that we've done is kept the subcommittee membership open. So while we have a main council for the Health Literacy Council of Delaware that is an established group of stakeholders, really we want to make sure that the community voice is heard in any of the solutions for the strategic plan. So that's sort of an open invite for those subcommittees, which is pretty fun. And it's helped us engage with more kinds of organizations because you can't have every single organization under the sun on your council. It'd just be too big. All right, so just another quick shot here. We did try to diversify, really have a lot of different sectors in the council structure. So right now we've got really strong leadership from ChristianaCare, where I work. We've got strong leadership from the Division of Public Health and from our Delaware Healthcare Association. That group kind of right now is the structure for sort of the executive leadership level, helping to keep things on track. But beyond that, we tried to include every health system in the state because if we are going to improve health, clearly we need to involve all of the people providing health care and the hundreds of thousands of touch points that come through all those care processes. We want to move the mission with all those folks as well. And then there are a whole bunch of other sort of statewide groups or partnerships that we wanted to have involved as well, like our Academy of Medicine, some of our academic partners, and then even getting some payer partners in the mix as well, because believe it or not, they want to communicate more clearly as well. So we should all be using the same strategies. In the middle of this page, just a quick note on our member portal. One of the things that we're using our website for is kind of to be a CRM, a customer relationship platform, where we can be pushing out messaging and doing engaging through our consumer campaigns. But we also want this to be a member portal where council members can find all the working documents and collaboration tools and things like that. So there's a password protected member area where we sort of are going to, this is just standing up just now. We're going to be having a working area for council members so that all those kinds of things can be really clearly communicated amongst council members, and collaborating on projects or assets is much easier. And then a third thing that's rolling out very, very soon is our organizational health literacy assessment tool. Now, you may have seen the health hospital-based environmental tool that Rima Rudd created. Sort of the original leap out at this in terms of doing a health literacy assessment for your organization. What we found is trying to apply that to our community-based organizations didn't really fit because it was so health system based. So someone on my team, Candy Muldowney, actually did a ton of work to look at that and some other tools and really refine this tool to be applicable to any kind of organization. So we are really looking forward to launching this. It's a digital assessment tool. You just plug in the numbers for your responses on how you're doing, and then you get a score back. And really, while a tool like that is pretty difficult to quantify, it can be kind of subjective. What it can do is start a conversation. So if you do that assessment, and then we provide you with an initial strategic plan for your organization or help you with that, now you're off and running, and you can do this assessment again in a couple of years and see what areas you're making progress in. So it's really meant just to be a catalyst for working within your organization. I know I'm blazing through these, but we'll get to the question part here soon. Just a quick note that there are a lot of people working in health and healthcare and public health who have the best of intentions and all kinds of skills, but it's not always the health literacy lens that we might want everyone to have. And so I just thought I would put this quote up here because the pilot partnership that we did with our folks from the Division of Public Health really landed well. Going through the whole process and really having that health literacy lens on when we were editing and creating a few assets for them really made them feel great about the process and kind of filled a gap in maybe some of the ways that they were approaching that communication. So that was certainly rewarding for all of us on the council who started that. I can see the formatting got a little interesting on the upload here, but getting started, we feel like we're just getting started. Our organization is relatively young. We are still constantly looking for funding opportunities to keep this work moving forward. And so on here, I'm not going to read all of these because you'll have this slide deck, but we were able to get another proclamation from the governor's office this year, which is fantastic. We try to have a premier event every October just to draw people from the state in, and we had a wonderful virtual panel last week where we did 4 different perspectives, the doctor perspective, nurse, community health worker, and a patient all together on a panel talking about what health literacy looks like for them. And then we're also starting a statewide public campaign because in addition to training up our healthcare workforce in the best practices for health literacy, we want to be able to message to the consumers of healthcare and the public to empower them and give them some tools, kind of like Cynthia was saying. We want them to feel like they can have a little bit of control over how they navigate health information. So we're really excited about that. Let's see, we've got the member portal rolling out soon. We also were able to embed this year in all of our community health needs assessments some health literacy questions for both stakeholders and community, and all the health systems agreed to do that. So that's really exciting to have that process starting. And then we've got some things lined up for the future. We'd really like to have a Delaware Health Literacy Partner Badge program where we can sort of certify people as really leaning into this and committing as an organization. So that's another thing that we're going to be experimenting with in the near future. Just to share a couple more things that you might see, or if you're on social media, We are trying to, again, not go this alone. We want to make sure we're embedding and partnering with as many efforts within Delaware to improve health communication as possible. So we have partnered up with a larger literacy movement in Delaware called the Delaware Literacy Alliance. We are sort of one subgroup of that. And so we are going to be, making sure that we utilize that model to support our finances and fiscal management, because that group is kind of working together to do that. And we want to make sure that we're sort of co-supporting all of our different campaigns. You'll see us as a council now on social media. So that's really fun, trying to get the message out there. And on the right-hand side, you'll see an example of that consumer campaign we were talking about. And one of the things there is to make that co-brandable. So it's a council designed asset, but you can see the black box there would make it co-brandable for any organization. And that way we're bringing some consistency to this messaging throughout the state. So that's one of our goals, is just to, we know what the best practices are. We just need to apply them consistently, and hopefully we'll make some progress. So I think, yep, there's the website, healthliteracyde.org. Thank you for the time today. Happy to answer any questions.
There we go. I'm unmuted now. Greg, you want to take down your slides and then we'll just have a little bit of a discussion? Great. So we got a couple of questions in the chat about engaging with policymakers and legislators, which we were going to talk about anyway, but I want to dispense with two quick questions. There was a question about the slides. So the slides should be posted for each session already that you should be able to download. And then the question about the web page was already answered, your web page. And then when is your organizational health literacy assessment tool going to launch? What is the date for that?
I don't have a date, but probably later this month.
Okay. Yeah. All right. So let's go to some of the naughtier questions, which were about finding champions in the legislature and how to, who's doing that work, right? Who's doing that engagement? So do you want to go first, and then I'll give the answer for Maryland?
Yeah, I mean, you're kind of leading the way on this. So we're just starting in terms of the policy side of things. But I think having the relationships and the partners is the first big step. So having some leadership on our council from the Division of Public Health is fantastic, because that's a big player in the state. The Delaware Healthcare Association, again, another big player in terms of coordinating all the health systems together. We do have a few key partners in the Department of Education as well. That is sort of a whole nother rabbit hole you can go down in terms of, and I see a question in the chat about K through 12 education and so forth, but that is a whole nother realm. I think what our next thing is, now that we've gotten a couple proclamations from the governor's office, is to go back and go for a continuing resolution so that Health Literacy Month is recognized every year as a standing thing. And then policy, we're looking at big P and little p. So we're going to start doing some legislative breakfasts or meetings and start finding those champions in the legislature. We already have an eye on a few who might be really interested in literacy. There were general literacy or early literacy bills passed in the last couple of years, moving along with the science of reading movement. So the timing is good for us to kind of come in with a health focus in terms of the policy. And then we want to go back to every health system and just make sure that each of the health systems has as robust of a policy around this as they can. So I'll leave it there.
Okay, great. So in Maryland, I would say our approach has been focus on the relationships first, right? And I had mentioned that I came out of a federal career before I came back to academia in 2017. And I had learned through the years that, when you knock on people's door and ask them for money, they tend to get their feathers ruffled a little bit. So when I first started approaching not just legislators, but leaders of key organizations and agencies in the state, my first conversation is, I'm new to Maryland. I would like to know more about your organization and what you do. And can we talk about a partnership, right? And so I invited local health department leadership. I invited the leadership of some key agencies within the state. And then I did have the chair of health and government operations on the center's first advisory committee when I got here. And so it was that relationship building that I did for 4 or 5 years before we got to HB 1082. So by then, people knew about the Horowitz Center before. Some people had even interacted or done projects with the Horowitz Center. But I remember one of the first phone calls I made to one of these state agencies, and the first thing the person said to me is, "I'm not going to give you money." And I said, "Well, that's good, because I didn't call to ask for money. I called to get to know you and find out more about what your organization does, because it sounds like we would have a lot in common." And so I think that I think it's the that slow, patient building of relationships, so people understand, okay, this is who you are. This is where you exist in sort of the health ecosystem, and this is why you're you're offering something of value. And that's why I also emphasize that we're part of a public school of public health, which I think really helps make the case for us, is that people are aware this was a center founded with a donation that has an endowment. But that doesn't mean that, the center is infinitely wealthy and can just spend whatever it wants. We still have to go look for resources like everyone else. And so I think just approaching it as we're here as part of a public service, and we see this as part of translating knowledge into action, I think has served us well over time.
Yeah, I think the relationships, like you mentioned, are key, because you're not going to affect change all by yourself. You're going to need structural things to change. You're going to need partners to buy in and do some work on their own stuff. It can't all be you guys pushing it all.
Right.
And I think it's really interesting too how we have a little bit different model.
Yeah.
With you, you're in an academic institution. I'm in the health system. So it's been a kind of fun experiment to see how our two states are progressing. It's going to be kind of interesting to see where that goes. Both can work. You guys have certainly led the charge with getting your bill through. So I commend you on that. We look forward to an achievement like that in Delaware as well.
Yeah.
Because I think what that has done is really codify, some structural change that needs to come along.
Yeah. And that's why I also talk about the other laws. I don't want people to think this is this is the culmination of many pieces that have been building over time. That, there's been this, first started out with, okay, let's educate our students, and then let's educate our licensed health professionals, and then, let's focus on the language access issues, which are longstanding, right? So it's been piece by piece. I did want to put in a plug for a session that we did at last year's HLiA, though. We invited the head of advocacy from the American Public Health Association last year, who did a session on how to be a health literacy advocate and how to work with legislators and how to do this education and advocacy. Because I think there's a lot of confusion. People say, well, I want to lobby. Well, you need to learn the difference between what lobbying is, which is like, you're a registered paid person, working on a specific bill, versus everybody can advocate and help educate people. So I would recommend that you go back and look up that session in the IHA platform in the Solution Center, because I think that was a very helpful session. That APHA, American Public Health Association, has some great resources on that. So we got 2 questions about our engagement with the education sector. So are we still working with K through 12? And is it adult or K through 12, community, all? I will just say in our case, HB 1082, the law actually specifies that we need to work with the education sector on developing some what they call health literacy content. I don't know exactly what that means. That's to be specified. Health literacy content and skill building for K through 12 plus college, university level. So we are just starting that work. We have done some outreach to the education sector. So I think more to come on that for us. But as anyone who has done work with the education sector, it's challenging to work with changing school policies and curriculum and getting new content added. So I expect this is just the first of many steps that we're going to have to take. So I don't know if you want to say anything about what's going on in Delaware in that sense.
Well, we've just barely dipped our toe in the pool on that one. But what I will say is that usually, to me, it seems to end up at a conversation around curriculum development, right? And I'm not sure we have like plug and play health literacy K through 12, curriculum that someone could just pick up off the shelf. So that's why from our strategy, at least for the next couple of years, is going to be creating those internal advocates and helping people understand and have some awareness around health literacy. So they're the experts in K through 12 education. And if they have a health literacy lens when it comes to purchasing a curriculum or developing a curriculum, that should start to move the needle. And then we can all be working, collectively on more easily implemented solutions that can be shared.
Yeah. And I think, a lot of our first thoughts do go to the curriculum, but you've got to have a teaching workforce, right, ready to implement this content. And so that's so the previous initiative under a previous director had focused both on training teachers, but also on some content. But my understanding is that probably will be one of the biggest hurdles we have to face here in the K through 12 is teacher readiness to implement any health literacy content. I will say at the university level, we had partnered with our sister campus known as the University of Maryland, Baltimore, which is where all our health sciences schools are. So medicine, dentistry, nursing, pharmacy, social work, law. They're all in the Baltimore area. We're 35 miles south of that for people who don't know Maryland geography. And back in 2020 to 2021, a group of students between our two campuses had done what they call a president's white paper and had looked at health literacy in health professions education. And they looked at what students within those schools, so our own school of public health plus those schools at Baltimore, what kind of health literacy instruction were they getting within the health professions context? Because you think if it's going to happen anywhere, it will help it happen there. And they wrote this, I think, very important white paper that's available on the University of Maryland, Baltimore website. And one of the things that came out of that is they did not feel their own faculty were ready to teach, because myself and a colleague here, we're the only ones that are dedicated to health literacy and teaching health literacy courses to public health students on a regular basis. And so out of that, we have Faculty Collaborative has developed modules for teaching other faculty on how to teach health literacy. So I think that's another angle to think about in the education space is what are we doing to help train our educators at all levels so that they can engage in health literacy education. And
let me just give a shout out to all educators because you're being asked to do a lot. I totally recognize that.
Yes.
It's a lot.
So we are at the end of our time, Greg. As usual, we always have more things to talk about. So we welcome people contacting us after this session. And, we're always happy to talk about what's going on in our respective states. So thank you for joining us for this session. We're going to have a 10-minute break, and then we will have the final HLiA session of the day. Please join us where we're going to be talking about environmental health literacy with our colleague from Montana State. So we will see you in our final session of the day. Thank you, everyone.